I'm pretty excited to talk about two topics that are of real interest to me. The first is stress and seizures. And I got interested in stress and seizures actually from one of my patients who kept pushing me and saying, Dr. Privatera, I know that stress triggers my seizures. What can you do about it? And I said, well, everybody's under stress. I don't know what to tell you. Maybe you should quit your job. But he was the CEO of a multi-million-dollar company. He said, I can't really do that. What I came to realize was that there are a number of people who think that stress is a seizure trigger. We don't understand why. We don't understand what kind of stress. We don't understand what kinds of particular seizures might be more or less susceptible to stress. And we don't really know what to do about it. So we started with a very generous donation from this patient, some research into stress. And what I found was a number of really interesting things. First of all, that a lot of people with seizures think that stress is a trigger. And there's a lot of research outside the field of epilepsy in stress. Like there's a lot of research in PTSD where people get stressed, military or other kinds of things, and people develop this post-traumatic stress disorder. So stress in that way is studied both in animal models and in humans. And I was pretty excited because it's an opportunity for us to take research that's been done in other places and bring it to people with epilepsy. So I'm going to show you a little bit about where we are. I think we're still early, and I think that there are a lot of people who are interested in this area. And in fact, in 2 weeks at the American Epilepsy Society meeting, which is the biggest epilepsy meeting of professionals in the world, we're going to be presenting some of these study results and also trying to get other people interested as well. So I think this is sort of quick, as Dr. Ficker mentioned. We know a lot about the brain. We know a lot about what happens in seizures, but we don't know that much. So we've discovered that there are neurotransmitters. These are chemicals that cells use to communicate with one another, and sometimes there's too much excitatory chemicals, and there's not enough inhibitory chemicals, or there's other kinds of problems where the cells themselves are just hyperexcitable, and so we design drugs to do that. So we have drugs that decrease excitation, drugs that increase inhibition, and drugs that try to stabilize the cells. And we have 16 new anti-epileptic drugs since 1993. And each drug, and this is an estimate from the pharmaceutical company, costs about $1 billion, with a B, dollars to develop. So if you look at a pharmaceutical company's spreadsheet and you say, okay, how much money are they putting into drug development and how many drugs do they get out? It's about $1 billion per drug. So it's way out of the budget of even a place like the University of Cincinnati Medical Center. We don't have $1 billion worth of research budget for all diseases combined, let alone just one. So it's very expensive, but it really, we have to rely on the pharmaceutical industry because they're the only kind of companies that have that kind of money. And as Dr. Ficker said, once you've failed multiple drugs, it's very unlikely that you will be successful on the next drug. Now, I mean, there's still a chance, and that's why we do it. And especially if you've failed because you have side effects, you're more likely to be successful on another one. But the idea here is that we keep developing new drugs. We have all these ideas, and we really haven't made that much progress in the last 20 years. So our idea was maybe let's look at stress modification. And the other thing that we're looking at, and which I'm not going to talk about too much, but is also interesting, is seizure prediction, the idea of trying to figure out when somebody would have a seizure, because it's that unpredictability that is really part of the dilemma that people with seizures have. And this is a very nice quote that summarizes, just says, the sudden and unpredictable nature of seizures is one of the most disabling aspects of the disorder. So stress is a common trigger. If you look at survey questionnaires over the last 20 years, it's 2/3 of the people with epilepsy will say that stress triggers their seizures, and it is the number one trigger that people talk about, because we talk about, well, drinking alcohol can make you have seizures, not getting enough sleep can make you have seizures, missing medications. For women of childbearing age, seizures can cluster around the time of menses, but the number one trigger is stress. And stress can be a useful thing. So, if you're a soldier in battle, you want that stress response. You want your heart rate to be up. You want to be able to respond quickly to changes, and that's the stress response. And it's there for a reason. But what we don't want is that stress response to be there chronically, or that stress response to trigger things like a seizure. So there's different ways that you can have stress. It can be in battle, it can just be sitting in traffic, or it can be financial. This is one of my colleagues with his retirement fund going down, down, down over time. So there's lots of different things that can trigger stress. And then the other thing that's difficult about studying it is the idea of seizure threshold. So if you think about it, and this is a kind of a diagram that's just not based on data, it's just based on sort of ideas. So just imagine, though, that here's your seizure threshold if you're somebody with epilepsy. And as long as you're down below this line, you don't have a seizure. And when whatever it is, not just stress, but any kind of a seizure trigger pushes you above the line, that's when you have a seizure. So, normally, let's say you're down here, and then even though your doctor said you shouldn't be drinking any alcohol, you go to a wedding and you have 3 beers or 4 glasses of wine, and unbeknownst to you, your seizure tendency goes up, but you don't cross this line, so you don't have a seizure. So then my patient comes back to the office and says, Dr. Privatera, you told me I couldn't drink, but I had 4 beers the other day and I didn't have a seizure, so you must be wrong. But in fact, what we know, what we think is that you can have a change in seizure tendency, but as long as you're far enough below that line, you won't have a seizure. But then if you get over here, here's the same person, missed a couple of medication doses, that pops it up, has alcohol, that pops it up more, and then stress, and boom, you go above the line, and that's when the seizure happens. So it's very difficult for us to understand how these things affect seizures, because they don't always, it's not like the same kind of stress will always cause a seizure. There have to be several different things sort of piling up at once, and we really have no way of measuring this seizure tendency right now. EEG doesn't measure it, MRIs don't measure it. So this is one of the things that we're very interested in our research, is trying to get some ideas about when somebody comes to the office, are they down here or are they right here below the line? So there are a number of different studies that make us think that stress reduction might help people with seizures. So one is a very important study from my colleague Cheryl Hout, who's at Albert Einstein College of Medicine in New York. And she did a diary study. And lots of people have done diary studies and said, okay, do you think that stress triggered your seizure? And they say yes or no. But her innovation was, each day she asked the person keeping the diary, do you think that you will have a seizure in the next 24 hours? So they had to predict ahead of time. And then what she found is that most people were not very good predictors, but there's a subset, like 20% of them, who were significantly better than chance at predicting whether they would have a seizure the next day. And the other so if they said, yes, I'm going to have a seizure in the next 24 hours, and they said my stress level is high, that was the combination that seemed to be most predictive. So here's the results of that diary study. So in that subgroup of people who were predictors, if they said, it's extremely likely I will have a seizure in the next 24 hours, there was almost a 40% chance, so the blue is a seizure, a 40% chance that they would have a seizure in the next day. But if they said it's extremely unlikely, then the chance of a seizure was only 5%. So it's not 100 and 0, but it's a pretty big difference between that kind of a risk and that kind of a risk. And this is, again, just based on diary studies. The other thing that was very interesting is looking through the literature, we found a very interesting study in people with multiple sclerosis. Because people with multiple sclerosis also say sometimes people believe that stress can trigger multiple sclerosis attacks. So what they did was they took people who had MS and they looked at MRI scans before, and then they put half of them into a stress reduction program and half of them didn't do the stress reduction. They just did they were a control group. And what they found was that on the scans, so this wasn't just how people felt, this was actually the MRI scans demonstrated that the people who got stress reduction had fewer new lesions on the MRI over that 12-week period. So that was very interesting. It was the first time any kind of counseling or psychotherapy had prevented new brain lesions. And then just recently, actually in the last few months, there was an article in Epilepsy, which is one of the journals that we publish our research about epilepsy. And this is a group from Hong Kong where they took people, Again, same kind of thing, but they randomized people. So one group got what's called mindfulness training, and I'm not going to talk too much about mindfulness, but it's one of the things we're very interested in developing later. It's kind of a meditation thing where you try to stay within the moment and feel exactly what's happening now and try to take away all thoughts of sort of the future or the past, but just live in the moment. So they put people through mindfulness and found that the people who got the mindfulness had improved anxiety, fewer seizures, and improved quality of life. That's a survey of quality of life that they do. And then finally, we did a survey in our clinic back and published this in 2013, mostly because we were just kind of interested in what some of the characteristics of people who thought that stress was a trigger for their seizures. So one of the questions we wanted to know was, is it acute or chronic stress? Is it, the death of somebody in the family, or is it feeling like my job doesn't pay me enough and I have these mortgage payments and, I can't manage over the next year? So was it acute, sort of hours to days, or chronic, weeks to month? And what patients said was it could be either. Acute stress was a little bit higher, but not much. And most people said both acute and chronic stress can trigger seizures. The other things that we found is that people who said stress was a seizure trigger were more likely to have both depression and anxiety based on these screens that we use. We have these special tools. One's called the GAD-7, Generalized Anxiety Disorder screen, and another one's a depression screen. But it turns out that anxiety was actually a stronger precipitant or a stronger risk factor than depression. And then one of the most surprising things was we said, have you ever tried stress reduction to help your seizures, and do you think it helped? And the vast majority of people who thought stress triggered their seizures said they had done some kind of stress reduction, and that could have been psychotherapy or just exercise or yoga or meditation. So the majority of people had, and most of the people who tried it said they thought it helped. And even more surprising, in the people who didn't think stress was a trigger, a lot of them had tried stress reduction anyway, and most of them thought that stress reduction helped their seizures, even if they didn't think on the diary that stress was a trigger. So we were very interested in this, especially before the study. So we designed a study called the SMILE study, Stress Management Intervention for Living with Epilepsy. And the idea was two different things. So first, people were going to get a stress reduction. This is called progressive muscle relaxation. So it's an older technique where people contract the muscles in the feet, and then you relax it. And then you contract the calves, and then you relax. And you kind of go up the body, contracting different muscle groups. And it takes about 5 or 10 minutes. And we did that with diaphragmatic deep breathing. And then the other group didn't get that. They were told, we want you to just write down the events of the previous day. And they also had these smartphones like this. These were specific, they weren't fancy smartphones, but they were specific for the study. And they would fill out a survey. So you can see on here, so this person, who's actually my nurse, is doing this survey, and it says, right now, how do you feel, unpleasant or pleasant? And if you put your finger on the screen, this little triangle comes up, and you can move your finger back and forth, from a 1 to 100. So where she has her finger is a 64, but if she just moved her finger to the right or the left, she could pull up a different number. So every day, twice a day, people would do these surveys about stress, do you feel depressed? Do you feel stressed? Do you feel like something bad may happen? Do you feel pleasant or unpleasant? This is another one. Which of these best describes how you feel right now, relaxed or stressed? And again, each day you could put it like that. How worried do you feel right now was another question that we did. So this is kind of a diagram showing the study. People who came in the study had to have at least 2 seizures a month, and we did that just because it's a way, if people have fewer seizures than that, you have to have a longer study to really look at the effect. So we tried to get people with more frequent seizures. And then they had a baseline amount, and then they just did the diary for 2 months, kept track of seizures and track of stress. And then at this point, they were randomized either to the active treatment, which was the progressive muscle relaxation and breathing, or the control, where they just wrote down the events of the day. Here's an example of what the diaries can show. This is actually a single patient with a seizure. So here he is before the seizure. This is the day before the seizure. So his happy level was 93 out of 100. It was a pretty good day. His sad was low, his nervous was low, worried was low, tense was low. And then interestingly, this is several hours before the seizure. The next day, the next morning, his happiness drops from 93 to 69, sad goes up, nervous goes up, worried goes way up, and tense goes way up, and then he has the seizure. And then the next day, he's back to his baseline, back to where he was before the seizure. So in this person, it was very clear from his diary that he was having mood and stress changes prior to the seizure. Now, did the stress trigger the seizure? Or was this kind of a prodrome before the seizure and he was just expressing the feelings of the prodrome? And that's another question that we don't know. That's a very important part of what we're going to try to do in the research over the next several years. So this is the summary of the results. So 67 people completed the 5-month study. And one of the things we were very impressed with is that people really were compliant with the diaries. 94% of the days, all the diary entries were completed. So we were concerned that after 5 months, people would sort of slow down and not be willing to do these diary entries twice a day. But what people said is once they got into the groove and started doing it, they would just get up and do their diaries every day. And it was really very helpful to us from the study. What was interesting is the main outcome that we were looking at is how did the people who got the relaxation do versus the people who got the control. Interestingly, what happened was both groups got better. So the active group wasn't statistically significantly better, but both groups reduced their seizure frequency. We think part of that may be just because the diary. Like when you start doing the diary and you start putting in your stress level and you start seeing when you have seizures, all of a sudden you start making that connection and then start maybe altering what you're doing because you realize just based on the diary entry that maybe stress is triggering my seizures and maybe there's some way I can try to avoid stress. We did some secondary analyses and some of those were positive, so that we're actually going to report the results of this at the epilepsy meeting. So the main thing is that we learned a lot about stress and we learned a lot about the next study that we'll be designing about how we need to do a control group and how long we need to do the treatment. So from a practical perspective, what do we do when somebody says, I think stress triggers my seizures? Well, the first is we want to treat for or check for treatable depression and anxiety. So we do these screens. Because if somebody has active depression or high levels of anxiety, we believe that maybe by treating that appropriately, which you treat separately than the seizures, that might help reduce the propensity to have stress as a seizure trigger. Other things would be to consider counseling to identify and address the stressful elements and certainly emphasize how stress can affect seizures. Again, in the study, I think we were able to show that to people based on the diary. People sort of figured it out themselves. They started saying, wow, I feel really stressed today and I do feel like a seizure is going to happen. And the last time I wrote that in, a seizure did happen. And then progressive muscle relaxation. If anybody's interested, it's a very simple technique, and actually you can just go on YouTube and do progressive muscle relaxation, and there's about 10 different YouTube videos from different places that will show you different ways of doing progressive muscle relaxation. So it did help people, and it's very easy to do, and it's certainly not going to make seizures worse, and it's not going to interfere with anything related to the medication. So thank you very much. That's the stress talk.